Hi friends, morning. I'm Dr. Ashutosh Gupta. I'm a consultant in fetal medicine. So today we are going to talk about fetal cardiac assessment. Okay, so there are few things that are easily missed, and but if diagnosed in a proper time, can really make a huge difference in decreasing the fetal morbidity as well as increasing its survivability. Right. So coarctation of aorta is one of the commonest cardiac lesions. It accounts to something around 8% of the cardiac lesions. And this coarctation of aorta, what happens is this: is distal aortic arch hoti hai, that gets narrow, right? So that the blood is not getting properly into the distal aortic arch, right? And so we can have some subtle signs of this coarctation of aorta antenatally, and if diagnosed appropriately, properly counseled, can really change the sort of prognosis as far as the fetus is concerned, right? तो मैं कुछ slides में आपको ये बता देता हूँ. So this is one case of a coarctation of aorta. So the suspicion arose because of the left and right ventricular discrepancy in the size, and this is a mid-sagittal view in which we are identifying that the arch of aorta is narrow and then the truncal arch is slightly dilated. We are identifying this aliasing of color on when we are putting the color onto it. This coarctation of aorta ना, इसमें 50% जो diagnosis होती है usually false positive हो सकती है, right? Okay, so there could be a lot of reasons by which we can have a discrepancy between the LV and RV. लेफ्ट और राइट वेंट्रिकल में हो सकती है, लेकिन स्पेशलाइज्ड फीटल मेडिसिन स्कैनिंग देयरफॉर इज इम्पॉर्टेंट, और अदरवाइज डेडिकेटेड फीटल हार्ट असेसमेंट ऑफ द बेबी इज वेरी वेरी इंपॉर्टेंट सो एज टू आइडेंटिफाई द सटल साइंस एंड टू आइडेंटिफाई दैट एक्चुअली वी माइट बी डीलिंग विद द कोआक्टेशन ऑफ aorta. तो टर्शरी केयर सेंटर में डिलीवरी, जहाँ पर पीडियाट्रिक कार्डियक सेंटर या पीडियाट्रिक कार्डियोलॉजिस्ट आर अवेलेबल, एंड देयरफॉर they are being told upfront that probably we are delivering, or probably this baby with such and such conditions is being delivered. So meaning thereby once the baby gets delivered, so the baby is there in appropriate care with the pediatric cardiologist. So this makes antenatal diagnosis of an coarctation of aorta changes the altogether and improves the sort of an prognosis, and decreases the neonatal morbidity as well as the sort of an cardiac the prognosis gets improved by doing an antenatal diagnosis and delivering them in a tertiary care center. Thank you very much for your patient listening.